Okay, so today we're going to cover the anatomy, or the muscular anatomy of the chest, back, and abdomen. And then we'll do a separate video where we'll do the head and neck as well. Okay, so we've got, starting at the chest, we've got this muscle here is called the pectoralis major. And then if we strip that muscle away underneath, we have the pectoralis minor right here. All right. Now, the intercostals work like this. Intercostal means between the ribs. The external intercostals, the angle of the fibers, if you look at my fingers, the angle of the fibers go this way. The internals, they go this way. So when you look close, if you can get in close to see, the angle of the fiber is going this way. These are external intercostals. And then the angle of the fiber is going this way. Those are internal intercostals. So you have to pay attention to the angle of the fibers to determine whether it's internal or external. Now we have, if we move down to the abdomen, okay, we're gonna have rectus abdominis, okay, straight fibers there. If we look, same thing for the obliques that we saw for the intercostals. You've got the hands, I usually say hands in the pockets, right? Because you put your hands in your pockets, your fingers are angled this way. And so that's always gonna be the external. So these are the external obliques. If you look on this side, the fibers are going this way, going the opposite way. Those are internal obliques, okay? And so we've got external obliques, internal obliques, rectus abdominis. If we were to go deep to those muscles, we'd have to pull off this chest cavity on this model. We're gonna do it on the small model though, okay? If we pull that off and we look inside, we've got transversus abdominis, which the fibers go transversely, so straight across. You can see those fibers going like that, okay? Now, one other thing before we get off of the chest and abdomen area, we also have these muscles here. This is called serratus anterior. So you can see them on both sides, those prong-shaped muscles there. And that should take care of the abdomen and the chest. We'll go ahead and look at some muscles on the back now. We've got the trapezius muscle that inserts up here into the occipital bone, comes all the way down to T12. So it kind of looks like a big kite because it's actually on both sides, but the model has it stripped off of this left side so you can see muscles underneath. But all of this is the trapezius muscle, okay? Here we have the latissimus dorsi muscle, okay? If we go up here underneath the trapezius, we've got rhomboid minor, and then here we have rhomboid major, so this right here. If we go adjacent to the spine, we have muscles called erector spinae. The one that we're able to visualize here is an erector spinae muscle called the longissimus. It's this one right here, okay? And then we have this fascia that covers the thoracics and the lumbars, kind of spreads out here in the lumbar region. This is called the thoracolumbar fascia, okay? That should take care of all the muscles in the back. We'll do another video doing the head and neck.